And we are live. What's up, everybody? Sorry we missed you guys last week, but we are back for another lunchtime live with Regenerative Sports Spine and Spa. We are your host, Dr. C, and myself, Daniel Tribby. We are the co-owners of Regenerative Sports Spine and Spa in the Orlando area. And we wanted to talk a little bit today about, this is an extension from a couple weeks ago, right, Doc? We did cosmetic regenerative medicine for like skin. We touched a little bit on sexual dysfunction, and this week we want to go a little bit of a deeper dive into sexual dysfunction and how regenerative medicine can help with sexual dysfunction. And sexual dysfunction is not just limited to men, right?
Correct.
Right.
Sexual dysfunction is also with women.
So what kinds of things would be part of sexual dysfunction? What kind of issues would we be talking about here, both for men and for women?
Well, it's like traditionally for men, you think about erectile dysfunction as, it's like whether you're unable to have erections or maintain erections, longevity, all of those types of things. For women, then you talk about other things such as vaginal, it's like tissue damage. We can talk about, lack of orgasms. We can talk about laxity, dryness, all those kind of things end up falling under that title, I guess.
Right. Super comfortable subject to talk about, right? Like nobody wants to talk about their erectile dysfunction or their, painful sex if you're a female, dryness, all those kinds of things. And what are the typical remedies for this? What are a lot of people doing when it comes down to sexual dysfunction and repairing that? Like what are most people, what's the typical treatment program, if you will?
Well, for men, it's typically medications, right? Cialis, Viagra, those type of things that you use. If it's bad enough, some people, some gentlemen may have surgery, which, obviously is not something that you want to do, but I think some guys feel like they have no other choice. For women, there's not a lot, actually. I think for the dryness, there's some medications like some estrogen creams that you can use. But other than that, I think women don't really do a whole lot for it, unfortunately. In both instances, it's unfortunate because it's like that's one of the things that I think people identify with so much with themselves as, it's like erectile dysfunction or vaginal dysfunction. It's like it becomes really hard psychologically on you, but then you don't feel like you're comfortable enough to talk about this with anybody, even your doctors. So that's like, I think that's one of the biggest problems is, it's like making awareness of these issues more than just what you see on commercials, and being comfortable enough to talk to, a professional about it, and then finding out other options that are available now. And there are other options available now that there were not before. So it's, definitely things that we want to think about in that aspect. Before we may have said, oh, well, there's nothing they can do anyway, so why even bring it up?
Right. Yeah. And I think too, what is the medicines that a lot of people that men take typically, like the Cialis and the Viagras of the world, like those things. A lot of people don't realize that a lot of those are heart medicines, right?
Correct. Yeah.
Yeah. So you were given these to help with heart conditions, and one of the side effects was, hey, so then they started marketing it as such, right? I mean, they started using it for those types of things. So and if you're taking those meds and you have some sort of heart condition, you go to the hospital, they usually will ask you if you've taken those, right? Because it can potentially be an issue for your cardiovascular system, right?
Right.
So in our world, what are we doing to help people and, give them that confidence back in their sexual health, but then also not pump them full of medicines, right? What are some of the ways that we can actually address this problem?
Right. So the first thing, with the erectile dysfunction, let's address that first. A lot of it's blood flow, right? So we have other medical issues, let's say diabetes, high blood pressure, all of those types of things, testosterone issues. So all of those we want to look at and make sure that those are controlled well. So unless those are controlled well, and then you're okay with those, nothing we do will make a difference, right? So you want to make sure that your testosterone's at a good level, that your blood pressure is controlled, your diabetes is under control, because those really do affect the blood flow and the tissues in that area. So once those are controlled and at a good level, if you're still having issues, then there are natural things that we can do now, which is injections. Actually, it doesn't sound great, but it's like it works. So it's platelet-rich plasma injections. We can use some sort of stem cell adjunct therapy as well, in order to work on the blood flow, regenerating the tissues in that area so that you can regain a lot of that, the strength and the likelihood, I guess.
Right. The livelihood probably is more.
The livelihood. There you go. The livelihood.
Yeah, that's it. So, and what is the typical long-term effect of this? Is this something that you have to do regularly, or is it a one-time treatment? And and how often does it work?
So it works, I'd probably say about 80% of the time, so it's not 100% of the time. Sometimes the issue has been going on for too long. And so, but it is definitely still worth doing. If it's been going on for a long time, we may actually err on the side of doing a stem cell treatment rather than just PRP. So there are reasons why we would choose one or the other. Now, if it is a PRP and we just need to get you going a little bit, those can be done even yearly in some people, and really just get those tissues working better. And then, it's like if you need a boost here and there, we can do that once a year. If you do like a stem cell type of thing, typically those last longer, and then you may not need repeat injections as much. So, but the treatments do work, maybe not permanently, but they can definitely help for a long time, few months to a few years, depending on the treatment.
Got it. And I know, previously I'm the physical rehab guy, and I've had the opportunity to work with a pelvic health therapist in the past, and she talks about men that struggle with erectile dysfunction after a prostatectomy. So if they had prostate cancer, they removed the prostate, or they had, maybe radiation therapy or something like that without removing it, and they lose the ability to, have an erection. And she works with those men, helping with the pelvic floor, controlling the musculature, and getting that return of blood flow and that potential libido back in motion. So that is something that I think is vastly important in combination with this too. We need to make sure that we're combining some physical therapy with that, because I believe it or not, there is physical therapists out there who work strictly with the pelvic floor and issues inside the pelvis, such as erectile dysfunction, or if you're a female with prolapse or bladder incontinence. Those types of things are super important as we talk about sexual dysfunction. But have you done this, or have as a practice, have we done this on anybody who's had prostate issues, as far as like the cancerous stuff, or they had to have it removed, and seen positive effects?
We have not, as a practice, done that personally, but I have doctor colleagues that have done this, and then it can help even in that situation. It's not that it can't, it's like, but I just haven't seen that personally in our office. But like I said, the reports are that it does still work in that situation to a certain extent. Yes.
Perfect. All right, very good. Let's switch gears. Let's talk about the ladies. What are we doing to help the ladies when they have some issues in the nether regions? What are some of the treatments like that compared to the men? How are they doing?
The first thing I would say is that don't feel like you have to be going through like menopause in order to have issues down there. I mean, lots of people have issues down there without even that being part of it. If you're having trouble with, dryness and laxity, and maybe you've had a couple of kids and things just aren't as tight down there, those kind of things, we can help with that, because that's all tissue degeneration, right? And loosening, those kind of things. So typically with the vaginal rejuvenation, we do PRP injections internally, as well as we use the CO2 laser. And that laser actually helps regenerate those tissues, tighten them up, help with lubrication, all of those types of things. And it's definitely not painful. It's like, that sounds painful, but it really isn't. It does not hurt. And we've done that a lot in our practice here. And so people do really well with this. And the PRP and the same kind of thing. It's like you may have to do this once a year kind of thing to keep everything rolling well, but it is a good treatment for the issues that you have. It can even help with your sexual function, and it's like help your sexual experience be better.
Nice. And then also, if you're having the bladder issues too, that we talked about earlier, that can be a
The
help.
incontinence, yeah.
Yeah.
It
So
can help with stress incontinence to a certain extent. I mean, if it's a large stress incontinence and there's some physical issues that need work, then it won't. But if it's a mild issue that you have every now and then, it's just annoying, then yes, it can definitely help with that.
very good. And then what is the actual? I mean, we do injections for the men. What's the actual like treatment involvement for women? So
it's injections as well. It's both injections for men and women.
Got it.
So
very good. So what is the what's your recommendation on, I mentioned physical therapy earlier, what is your recommendation on physical therapy after these procedures, whether you're a man or a woman?
I believe physical therapy is extremely important. It's like whether you're a man or a woman, because that is part of it. It's like if your tissues are degenerating in that area, it's like part of getting those stronger and working better is going to be some pelvic health therapists, right, and exercises. So that is essential, and that works really well together in order to get you where you need to be. If you just do one or the other, you're not going to get as good results as with anything else. Yeah.
Absolutely. All right. So what else do we have to talk about when it comes to sexual dysfunction and the types of things we can do in our office to help? What else are we missing here?
There's an interesting treatment that a lot of people don't know about. It's like for men, we can actually do dermal fillers to help with a little bit of girth, interestingly. So it is done. It works really well, and men are typically very happy with it. So.
Because normally we talk about fillers, we're looking at, like the Kylie Jenner lips, or do something to the cheekbones, or, make my eyeballs not look so, sunken in or saggy or whatever, but we can actually
use. Your cheekbones are here, not here.
Most jawline, cheekbones.
That's right.
Correct. So we can actually use fillers for girth for men.
We can actually. It's a very interesting treatment, yes. But yeah.
But you're going to get maybe 90 days, 120 days out of that before you have to repeat it again?
About a year, actually. Fillers last for about a year. Mm-hmm. Yeah.
Wow. Okay. Well, that's something. Well, I guess the Botox is more of the, you don't want to put Botox down there. That's a no-no. Yeah. Okay, so fillers we can have for good. Yeah, that's not bad. So, so if you're struggling with that type of situation, definitely take a look at our website and reach out and contact us. I know it's not a comfortable discussion to have, but it's better than suffering with that feeling of insecurity or not being able to enjoy your partner. And sexual dysfunction does affect a lot of people. I know what I was going to ask you. How big of a role does hormone imbalance play in sexual dysfunction?
So it depends on what you're talking about. For men, it can play a large role with the testosterone, but it's also similar in women because women actually have less testosterone than we want a lot of the time as well. And so then that affects our desire, right? So I think that's an often missed thing in women is that our testosterone also drops as we get older. And, it's like with all the other things that we go through. So the hormones play a big role in that aspect for sure, in, the desire to and all of those types of things. But also, as we talked about a little bit, with the vaginal dryness, things like that, it may be the estrogen is too low in that area. So there's other things that we do need to check for both men and women. The hormones do play a big role, and that will be part of the treatment, that we look at all the hormones and then balance everything that we need to in order to make everything optimal.
Got it. Awesome. All right. Very good. Well, if you are in the greater Orlando area and these are some sensitive subjects that you're, having issues with and looking for a more natural healing process for you versus taking medicines and all those things, we would love to be able to help you out with this. Definitely check us out at regen, the letter S, the number 3.com. reach out to us, give a call to our office. We can set you up with a consultation and hopefully get you back on the path to recovering from this, often embarrassing and life altering situation. So, and if you are not in the greater Orlando area, definitely give us a shout, because we do have some VIP packages that involve complimentary car rides, a place to stay. We get you to and from. The only thing you got to do is get your butt here on a plane or in a car, whatever works best for you. So we do have that available to make life super easy for you. Other than that, we'll be back again next week for some other regenerative medicine talks. Everything natural healing to help you recover from not only just muscle and joint problems, but things like your skincare or your hair loss, or in this case today, your sexual dysfunction. So if you are watching this post live, please drop a comment, ask a question, give some likes, give some loves to it. We definitely will go back and answer these later. And Doc, any closing thoughts?
I think we're good. We covered it all.
All right, very good. Well, I hope everybody's staying safe and staying healthy, and we look forward to bringing some knowledge to you guys again next week. Have a good one, everybody.
Thanks, Daniel.
Mm-hmm.